Welcome to the Healthy Aging Pod. I'm Kelly Yee. You can follow me on Instagram at Kelly Yee Yoga or subscribe to my YouTube channel at Avatar Yoga. In partnership with EPC Canada, we are excited to bring you our Healthy Aging webcast series. Our guest today is Dr. Theodore Cosco, an assistant professor of mental health and aging at Simon Fraser University and research fellow at the University of Oxford. Dr. Cosco is a chartered psychologist trained in applied social research methods and epidemiology. Using both qualitative and quantitative approaches, Dr. Cosco examines a range of factors that promote healthy aging and resilience in older adults, from digital interventions to physical activity. Hello and welcome, Teddy. Hello, Dr. Cosco. How are you today?
Good, thanks. Good. Thanks for having me.
Welcome. So is it okay that I call you Teddy?
Yeah, absolutely. Yeah, everybody calls me Teddy.
Great.
Dr. Cosco is my mom, so.
Okay. Sounds great. So as we know, we've been talking a little on mental health during this current climate, should I say, this current situation. And so before we even go into that, I'd like to ask you, what is the definition, or what does mental health really mean? Both from an individual and community perspective, so community and society perspective.
Sure, and I think that's a really important question, and I think that that's one that people don't often look too deeply into, because you have, classic mental health, but which is really defined by illness. So where there's mental illness as being the opposite of mental health, and historically, psychologists and the medical community have looked at pathologies. So do you have major depressive disorder, generalized anxiety disorder? And a lot of what mental health was lumped into was, do you have a clinical condition or not? And if you don't, so this absence of a pathology was the presence of positive mental health. And I think that framework has really shifted. Like the WHO says that there's no health without mental health, and that good positive mental health isn't just the absence of these pathologies. So I think that mental health is really expanded, and from my perspective, it's the whole spectrum, from at one extreme end having clinical pathologies to having on the other end of the spectrum a really positive, self-actualized existence. So having a really high level well-being, high level quality of life. So it's really, to me, mental health means a whole spectrum of positive or negative well-being, and at the individual level, that's really defined by the person. So what is positive mental health for one person might be not so great for the other person, and so I think it's really an individual thing. And then to the second part of your question, looking at whether like at a community or societal level, I think that you can, again, you have these individual perspectives on it, so it's hard to put a population level individual perspective on it. So it tends to be in more like the pathologies perspective at a community level, looking at who's above or below average on whatever score it might be. So that's a long-winded answer to that. Mental health can be a lot of things to a lot of people.
Yeah, and I think that's where I'm sure we'll kind of go into this a little bit more as we dive into this, but that's where I find, we kind of lump in mental health as this umbrella, right? Like mental health issues. And what does that actually mean? Because that sort of, it's like we all have like mental health issues, if you want to actually look at it that way, both positive and negative, right? And it's a balance. And then there's like you said, there's sort of this idea of, from one extreme, what we would deem as, I guess, normal, to having actually maybe some challenges with it in the mental health side of things.
Absolutely.
So on that note, how do we know if it is a problem or issue versus normal and healthy?
So that's another challenging question, because you have these sort of individual perspectives and then you have a community perspective. So I think that at an individual level, you have your sort of baseline, and every individual has their baseline for what is normal for them. So you can, so for me, if my quality of life is here normally and it decreases by X amount, that would be lower for me, but that may be somebody else's baseline. So you can have, so at an individual level, you can have variation from an individual, from your personal baseline. Then when you look at sort of at a population level, you can, if you were able to magically survey everybody in a population, then you could get what's normal for the population and then look at that relative to what a population level, what's normal at a population level. So that has interesting implications for research and for how you look at mental health, because everybody has their own set point of, you know, quality of life, life satisfaction, different aspects of mental health, and what it could be a high level of functioning for one person is a low level of functioning for the other, and the deviations from that is, I think, is really the most important part, and it's tough to capture at a population level.
So what are some challenges and factors that need to be considered, I guess, from a research standpoint?
In terms of trying to foster mental health, or in terms of mental illness and disorder, that sort of thing?
Fostering mental health.
I think that there's a lot of having resources that foster mental health is one aspect of it. Having access to, you know, a psychologist, or having access to, you know, healthy foods, access to, you know, gyms, that sort of thing. That's one component, but the uptake of those services and those resources is really the critical component. Because just because you can go to the gym doesn't necessarily mean you will. And so that sort of having access and then the uptake of those are two different things. So you really need to have both. So if there's a shortcoming in either of those aspects, that can pose challenge to trying to foster mental health. Because if you don't have access to the resources to begin with, it's a bit of a moot point. But if you have access to the resources and you don't avail of those resources, you end up with the same result. So it's really a challenge in trying to identify what works for you, and then, you know, find the motivation to, you know, invoke those resources to try and foster better mental health.
Great answer. So switching into, we know this past year has been quite challenging, you know, with the pandemic of COVID-19, social distancing requirements, and of course to the political climate that we're also kind of faced with. It's increased stress, and we see this sort of all around, and I think we all can see it within our family, friends, circles. We can see it within the communities, and research has actually shown that this past year has actually shown higher divorce rates, of course, job loss, and increased isolation. So how can we recognize mental health issues either in ourselves or in others? Or is there a way?
There are ways, but, you know, as with most things in mental health, they're not always super straightforward. So I guess sort of going back a step to what I mentioned about sort of individual variation, and so you can have what is like a clinical pathological mental disorder at a population level, and that can be diagnosed. That's sort of when it's easier to identify when it's an issue. If you have a clinician diagnose you with a mental illness, that is clearly something that needs to be addressed. But I think where it gets a little bit trickier, and I think this is where the bulk of the population finds themselves, is in this sort of subclinical challenges with mental health. And that sort of speaks to the individual variation. So everybody has their own sort of set points for, you know, depressive symptomology, anxiety symptomology. They sort of exist on a spectrum. And when trying to recognize these things is a real challenge in self-awareness, and even in with people you know. But the key bit is the variation from your set point. So based on, you know, what it was like last year, with everything taken into context or consideration, you know, do you have lower levels of well-being? Do you have a lower quality of life? And trying to look at whether things have changed. Overall, are you less happy? That sort of thing. And that's been a big challenge within the context of the pandemic, because it is just everything has become more challenging. Like, pick an aspect of life and it's become more challenging. So I think the trying to recognize and having the self-awareness to be able to recognize these things is equally as challenging. So I think taking a proactive approach to it. So trying to foster greater mental health even before things get bad. So trying to be proactively, accessing resources that foster mental health, doing things that make you happy, that sort of thing, before they get to that stage where they get into more problematic areas, or long before you get into a sort of clinical diagnostic sort of scenario.
I love that you're saying that. It's like this prevention type, and like you said, there's a need for you to kind of have self-awareness, to know what your baseline is before you even get into these stressful situations, which we know is difficult, because we're often kind of going through our day-to-day lives without trying to avoid or knowing who we are, right? So I love that you're saying that, because I really think that this is a very high value for all of us, not just in this time, but for all of us to be figuring out like who we are, and our level of happiness, so that we'll know the difference as to when we're at a higher stress or higher anxiety or whatever it might be, so that we can deal with it, using either strategies or techniques based off of research, and speaking with therapists or whatever it might be, to know to even go to therapists, right? Like,
yeah. Like, I think a real within like the clinical framework, when any sort of on that spectrum of functionality within mental health, it's really when mental health issues are impeding your capacity to do your job, having a negative impact on your friendships and your relationships and that sort of thing. That's when sort of red flags should start going up, and that's like when you start getting into some more significant issues, and that's sort of a good warning sign for when, if you're sort of feeling down a little bit, but then it starts to negatively impact relationships with people. You're having trouble at work, that sort of thing. That's a real a red flag to sort of be mindful of, for sure.
On that, what are some coping strategies that maybe you've discovered in your research, if you have any coping strategies? Because I'll just sort of make mention of this, as a yoga teacher, I know that yoga has helped a lot with my clients, and it does help with like the physical, mental, and social aspect, right? Like, you get the physical activity, there's the mental health component, meaning, building that self-awareness, body awareness. And then, because if we're doing it live, whether it's online or in person, there's that social connection at the same time. So I know that yoga has all of these components that has been both told to me by clients, and I know for myself that it's highly beneficial to help with the emotional regulation, just keeping me sort of more grounded versus spinning out, or when I'm personally in like a stressful situation, I need to kind of go into that yoga space, breathing, meditation space. So what other coping strategies would you recommend or make mention of?
Yeah, like, I think what you've just spoken about within like the context of yoga really touches on like two big aspects that the research, and specifically the research that I do, would support, looking at like physical activity and social connectedness. And physical activity has a whole host of benefits. You obviously get like the physical benefits from that, but also you get psychological benefits. Physical activity is associated with lower rates of depression, that sort of thing, lower rates of anxiety, and there are a number of different. There's an association between greater physical activity and better mental health. But the interesting bit with that is it's not entirely clear what the mechanism of action is. So is it just going for a run that releases endorphins, improves your mood, that sort of thing? Or is it that getting out, getting some fresh air, change of scenery in green space, that's the mechanism? Or is it the social component, where you are able to go out, like a lot of these walking groups, where they'll do a study where there's an intervention where you have a group that goes walking and then a group that plays bingo, sitting down in a community center. And is it the social component of going for a walk? The walking part is the physical activity, that's the intervention, but it's also this social component that's layered on top of that. And then with the social component, you're also getting that cognitive stimulation. You're having conversations with people, you're being able to chat about different things. And so there's that component as well. So yeah, the first one being physical activity, and the second one, and that is, I think, has never been more important, is social connectedness. And there is, the way that I describe it to friends and family is that the casual friendships and relationships that you have sort of fallen to the wayside because you need to be very intentional. You don't have the people that you run into in the office. You don't have these sort of friendships of convenience. Everything is so much more intentional. So it's more about, you have to pick up the phone and actively call somebody. You're not just going to run into them on the street. So that social connectedness component, I think, has never been more important. And just because we're physically distanced, we don't have to be sort of socially disconnected. So I think that you have to be sort of even more attuned to your social connectedness, and recognize, hey, I haven't talked to my brother in ages. I should probably give him a call. And when normally you'd see them at a family dinner or something like that. So that social connection component, I think, is one that I study in great detail, because it's a critically important component for older adults, particularly, who have diminishing social spheres. And so the greatest coping strategy that I have personally, and that the research would also support, is just picking up the phone and making a call, and just increasing the quality and the quantity of the social connections that you have.
In our next session, Dr. Cosco and I discuss the secondary outcomes on our mental health as an after effect from the pandemic. Follow me on Instagram at KellyYoga to find out when the next video will be posted. Thanks for watching the Healthy Aging Pod.